First thing we want to do is try and get it nice and straight through the back. Don't leave them with too much arch in the back, because normally they're going to have upper and lower cross. They're going to have the forward head, flex neck, flex lower back. So we want to try and straighten that out. First thing we're going to do is try and get them nice and straight. So hand down over the sacrum there, the hand just underneath the occiput, and I'm going to do a nice little stretch there. Just a nice stretch there. Okay. It's not supposed to feel too huge, especially if you're not pregnant at the time. Okay, so if you guys don't feel a huge stretch, that's perfectly fine. Okay, who's got to read my bowl bits for me?
Jaw masseter muscle release.
Jaw masseter, thank you. Okay, so up on the jaw here, I'm going to do some circular thumb frictions. So just keep kind of wandering around here, guys, so you can see. Right. I think just to be nice and comforting. I'm going to do a little bit of cross fibre work there. Well, your one gets done lightly then, just probably a bit of T&J. Okay, and where it does say the separating work is just trying to do a little bit of fascial stretching there. So it could either be both thumbs, try not to get anywhere near their face, or you can just use the fingertips. Okay, nice and easy, nice and light. Very good, particularly if they are clenching their jaw a lot. Alright, next one.
Occiput traction.
Okay.
Gentle.
Standard occiput traction there. That's with our arm opening up. Okay. It's going to be opening up through the side of the neck. See all that stretch I'm getting on the traps there? Don't try and do deep tissue work. It's not what we're after. Okay, just be quite nice. Next one.
Stretch and traction.
Which one? I've got two stretches there. Oh, I've got the arm up overhead.
Yeah.
Okay. Look around.
You want me? That's it.
Yep. It'll be fun for watching. So make sure that towel stays high. You're going to bring that arm up over their shoulder there. They do have a bit of ligament laxity by nature, a bit of relaxing going on. So don't put too much pull on the shoulder itself. You don't want to dislocate it. But hand up over the head there, hand down on the hip, and the main part of this stretch is going to be to push away. Okay, nice little stretch through the side there. So what am I stretching out mostly? Lats. Lovely. Hey, you're supposed to be having a massage. Lovely. Then we've got the chest stretch, yes?
Chest stretch with
Okay, I just want to make sure that the scapula doesn't move too far so we actually get a chest stretch. Just going to bring that arm back there. So just make sure your draping's all in good position. This is where that snuggly towel is very good. It sits over the chest there. Don't try and go too far again because you'll have the relaxing effect. Okay, just pull back and down and across your chest for me. Nice little stretch there. And relax. A little bit further. Again. And relax. And then we'll do 3 or 4 of them as PNFs. Okay, so that's just going to stretch back mine up really well, same as if you were doing it through the door frame. Okay, same position. Okay, there we go. Yep.
sliding compression.
Okay, sliding compression. Yes. So what we want to do is work the traps a lot here. Okay, open it up. So get the compression down, separating through the traps, work all different angles through here. Yep.
Stripping.
Okay. So you will see me jumping around a fair bit, and that's only just because of the positions you need to be in to actually get in the neck and shoulder. I don't normally do routines like this. Alright, so working down the scalene itself, if you want to make a little bit more space, just push that shoulder away a touch. So slowing down the scalenes from the mastoid down towards the base of the muscle. Again, this isn't sports stripping. I'm not trying to get in there and really release everything to the full degree that I can. Just a little bit of nice light stripping for them. Work down through. lav scap as well, so heading back towards the shoulder there. So just working back on the angle. Okay, I'll swap the hands over and use the fingers. Okay, so you want to get behind scalenes and in front of the upper traps. Okay, how's that feeling through there? It's all good. Lovely. She'll fall asleep on me soon.
Using aromatherapy oil on the perfect.
You can use them if you know your aromatherapy oils. There's some really good ones.
Careful to it.
You do. You got to use the right ones at the right time. Yeah. Okay. Then just a little bit of work there. Down through the back of the neck. And
Maybe.
next look. Okay. Maybe. Stay there. Okay. Our usual leading traps there. Remember, we've got that point in the middle of the traps. We don't want to do a lot of heavy pressure over, so you see I haven't been digging in there. Okay. Just a nice bit of kneading in there, picking up.
Why is that? You were saying? You said it once before.
Just the energetic effect on. It's got a very strong descending action. Any other stripping techniques?
Palm stripping and knuckles.
Yeah. Okay. So with these two, you're generally going back and forth the table again, so I just keep swapping. But it's as I'm just working down. So I'm actually going to work with my knuckles backwards here. Just push that shoulder just a touch to get some space and slide down between the scap and the spine. Alright, make sure you're not really knuckling either one there. I normally do a nice little bit of work through here because that gets really, really tight. You can't work so much through the top of the traps as usual, so we just have to modify and work elsewhere, and hopefully we get that rebound effect. Okay, so you'll have to shuffle around here just a little bit there, because I'm going to work there with the thumb, which you don't put any pressure on the front of the neck, and that thumb is going to work down the back. So I'm going in here, just sit my weight behind it. Alright, one of those strange ways where we're actually working kind of backwards, but it works here so well. Try and keep the thumb straight. I know I bent mine a couple of times there. Feels good, doesn't it? Yeah, nice and tight in there. Alrighty. Yep.
Maybe purchase
The shoulder?
Top arm.
Right, upper arm. Yeah, upper arm. So, hang on, I thought my shoulder was done there. Work our way down now, all up the whole forearm. Push it in there, isn't it?
Yep.
Yep, good. Would be in trouble if it wasn't.
Why is the garage not the safe position?
The effleurage here can actually be substituted into a few positions. You can do it right at the end, or you can do it, if they do have a lot of swelling in their arm, because you want to do a little bit of lymphedema work, you'll actually do this work really, really lightly, okay? And then your effleurage, if you bring that arm just up onto the hip, you get a nice straight run, and then we'll do some nice, there's a C cup, so I'm looking in that letter C there, and what you can do is, you'll see that just that light bit of skin movement in front of my hand. If they do have a lot of swelling, you do it really, really lightly, and that's really good for trying to get some of the fluid to move out of the limb. So if they had a bit of lymphedema where I've been working, just trying to work my way up, okay? So there's another lymphedema stroke after that one, isn't it? Straight after it. And then you might actually use that one first. So it just depends on what they've got wrong. If it's mainly fluid, do the fluid techniques first. If not, just do them a little bit through there anyway, because they're quite nice. Cat scratch, it's always the way that I remember it. So I'll whack it in your notes anyway. Cat scratch is actually just drawing that fluid out of the area. So if you were going to use it, you'd be using this one first, ticklish. Okay, if it's ticklish, we're just going to go just that touch heavier. Because you guys know you can't go very deep at all, or you start shutting down all the lymphatic vessels. So funny enough, I've done some deep work in legs that were swollen and it's gone away. Interesting. Okay. Different schools of thought. You can try and work at the area that's swollen and bring it up, or you can actually work from the high part and try and make space, actually work your way back down to the swollen part. So you're trying to move the fluid higher first. Okay. That does make a lot of sense to me. Okay, so you can work from high up and work your way down. All right.
Compression separation.
Bicep work. Take that hand, nice and relaxed there. Compression and separation through the forearm. And back of hand. They are very swollen. You may actually omit this in any of the tractions. Don't do any of the tractions if they've got a lot of swelling, because all you're going to do there is pull any of the bones apart as you're tractioning, okay, and let the fluid settle in there, and then let them go. Okay, so you're actually going to bring the fluid into the area more, which you don't want to create space for fluid. Okay, so that was the next one. Sorry, with the compressions, if you're finding nice tight spots, we'll get up and work in there. We found all those tight spots earlier, didn't we? So have a bit of a play with them when you partner if need be. Okay, rotation and traction of the fingers.
No traction and
Yep, yeah, no traction if there's any swelling. Get them back up to the upper back, don't I?
yeah.
Okay. I'll dig oil in at the end. Oh, your skin loves it? Good, you can leave it on there then. I'm just going to make sure that my bottom towel is up high enough there, which it is. Tuck it in there. And see how where her arm is? That's just perfect for me, isn't it? I can't throw that towel too far. Alright, I've got a perfect little stop. And has a lovely bit of back, she can stay warm. Okay, a lot warmer than we normally keep anybody else. Remember, they're perfectly prepared for them. Their bodies need it. Alright, this is where electric beds are wonderful. And I want to go up a little bit. If you don't have an electric bed, you've got to make that choice of, are you going to do a lot of work from on the top of the hips and the leg and you need to have the bed lower, or are you going to do a lot of work on their back and you have to have the bed higher. Okay, the reason why I say higher is I've actually got to get quite low here to be able to do my effleurage, more than you normally would be if you were working down on top of the person. Okay? Alright, so effleurage to the back. What's my next one?
Bladder points.
The
Bladder points.
bladder points, okay. Here's a set of points that, again, it goes on with the reflexology with the Chinese medicine theories as well. But what you have is, all along your spine, you have the muscular nerves, or the musculoskeletal nerves, which come out from the back of the spine, okay? They come out at each joint between the vertebra, okay, each spinal joint. So you can push right next to the spine to try and get an effect on those nerves, or you can actually push, the actual distance is 1.5 fingers, and we'll talk about the finger distances last week a little bit, okay? But what that's going to be is right in the middle of the belly of ES, okay? So as you're working down, the spine's going to be curved a little bit because they are laying on their side, so you've just got to follow it. So if I want to do these points, start up as high as I can, spread out into the middle of that ES muscle there, or like I said, you can be sitting right in next to the spine. Okay? If they do have quite a tight back, you can see why right in the middle of ES is going to be that slight better option there. And the thing is, these nerves affect all the organs within the body as well, because you have the front pair of nerves which come out, which go and supply all the organs. So if you're working through the thoracic area, you're going to be working on nerves supplying the lungs and the heart. If you're working on lower thoracic area, you've got a lot of the digestive organs in the stomach and spleen, liver. When you're working down into the lower lumbar region, so you can see I'm just actually lining up that vertebra every time because she's on a side. Okay, I would actually normally be just in behind here a little bit more. And if I start to feel like I'm bending to one side a bit too much, okay, you only have to do this on one side, you don't have to do it on both. Okay, or if you know you're going to do the other side, we could actually cheat and just do one side and save our backs a little bit. But I'm showing you the two-sided method. Or I can then swap and come around here and then work the other way. Alright, just so I'm not leaning one direction for too long. It's all about saving your own body, isn't it? Okay, so it's just a nice thumb pressure in there.
Kneading is next.
Now, how low did I say we should go with anything like this? I did tell you why.
Don't go over sacrum.
I'm not going to go the sacrum. Why not?
Labor.
Reflex zone for the
Reflex.
reproductive organs, and we kind of don't want to create any reflexes in the reproductive organs when there's a baby in there. Alright, so that's as low as I want to go, which I can feel the top of the sacrum there. Okay, so nice and easy through there. Next one was
Kneading.
kneading. Kneading to the back, so we get right in the middle of it and do actually a bit of kneading. You normally can't knead the back very well, but from here you definitely can. Gives us with that little bit extra skin.
All that extra.
No, it's fluid, you're pregnant.
Oh, that's
Alright?
Yeah.
Go away with the baby, honestly.
I'll do that now.
Alright, next one.
Circular apparatus of the abdomen.
Okay, so then we come around to abdominal massage. So we have to redrape now, don't we? So that's our back done, all nice and easy. Okay, when I did do a little bit of those knuckles as well, just to show you that you can use it a little bit further. So where I was using it from the top there and coming down, you can actually bring that down, just support them, and you can bring that all the way down the back so you can get a little bit of knuckle friction, and if you really need to, a little bit of effleurage down through the lower back. So we're going to do most of our lower back and hip work next week. Okay, this is just your very basic work. Okay, so from here I've just got to check where my towel positions are, make sure that's up and over the top of the hips there. Okay, now I've got her arm stuck inside that towel, don't I? Do I need to take that out yet? No, as long as her arm's up here and not down on her belly. So if her arm's up on her chest, all I've got to do there is make sure my lower towel is in the right position, and I can actually take this one and now fold it up. And I should have the bottom of my snuggly there, and now I've got the belly exposed. Okay? So I'll just show you from the front. So I had that towel there, I was already in position. So you've got to kind of undo this in order, or you're going to end up all over the place. So I can just fold that towel up there, and what I'll normally get is either the lady itself just to lift the belly up and stick it underneath there. So I'll just pretend you're pregnant.
Right.
I'll get in there and I'll just tuck it in under the front of the hip. Okay? We normally have a good bit of belly in here. If they were only 3 or 4 months pregnant, actually in the first 6 months I wouldn't even bother doing this. The first 3 can actually be quite dangerous. So this is for end when they're quite big, we start to do the belly. Can you pull this up a little bit for me? There we go. That's better. Tuck in the undies there. Beautiful. Now you've got to imagine that we're going to have much more belly to play with here. This is going to look very, very small because I don't have the pregnant person that I was hoping to have. Very disappointed about that. Well, that was your friend, wasn't it? Okay, effleurage.
Yep.
Okay, circular effleurage. We've all done our abdominal massage before. So I want to drop my bed again. Only for the back do I want it that little bit higher. Does it matter which direction we go?
Yes.
From the right to the left.
Why?
Digestion.
Yeah, okay, we've got a baby in front of it now, so it doesn't matter anymore. Because you're not going to get that deep, are you? You're going to be very, very nice, superficial, nice and light. Okay, so I would actually do a much bigger circle if I had a much bigger belly. Just imagine this all a lot bigger. Okay, next one there.
Lifting palm strokes.
Okay, so that's lifting. You can lift 2 ways here. Okay, if you are doing the belly massage, you've got to take that belly towel out as well. Okay, just so that we can get in under it. So we can actually lift up across the belly there. Okay, it's just hilarious when you start getting kicked. I always get kicked when I massage. This is probably the one thing I don't do very frequently in my clinic because I always offer it, and a few ladies have gone, yeah, but a lot go, no, I don't want to get that done. But babies kick me, I'm working around backs and hips, and I feel a baby kicking around me all the time. All right, so lifting strokes there, and we can also lift up, which is very much not going to work on you, but we can work up over the belly. Okay, don't try and go deep. It's just all nice and be soft, but just firm. Just go to the edge of the firmness of the pregnancy, basically. Okay, so you don't want to push too deep into the tummy.
Mirrored strokes.
Mirrored strokes. All we're going to do here is just that connection between the belly and the back. We're just going to do effleurage. Doesn't matter which direction we go. Okay, just think you're chugging along like a train. Remember the pirouette? Does that feel nice? Remember the pirouette? There you go. Oh, the pirouette again. Oh no. I can't do that.
about that the other day.
Were you?
Yeah.
Okay. This was so weird doing that on a pregnant person. Actually, this is one that I have had more comments on, and I've just sat there doing this for 5 minutes or so. It's just nice. Because all you're doing is the exact same thing on the back. So all you're trying to do is just get that connection back into the body again, because it can feel a little bit, alien having this baby there. So you're just trying to reconnect the body with what's happening. That's all the belly massage is about. Back to effleurage.
Yeah, circular.
See, I remember this part because there's only like 4 techniques. I always do these if I can get the chance.
And then holding.
Okay, that's going to be on the lower abdomen. And just connecting.
Upper and lower.
This is where you go. Come on, kick me.
And then
They do.
legs.
What's that?
Leg.
And then onto the leg. All right. I definitely want you up here for this part. Just take a little bit of that off the belly. Don't think an oily belly is going to feel all that. Brilliant. So how am I going to undo this towel? I'm going to cover the belly back over, then cover the back over. Oh yeah, hang on, don't forget about the towel here. I want that towel, don't I? Okay, untuck that part, and under there. If you have got it tucked under the belly, just a quick little pull there, and it'll just pop out from there. So as I said, middle of the edge of the towel, okay, so that's about halfway there. Hold that on the side of the leg, and bring the front and back of the towel in as we come up. Alright, I don't need that towel there now. It's always a lot easier to do in your clinic. There's your undies, thank you. If you've got big bike shorts on, this is very difficult to do. Lift that leg up just very slightly for me. Underneath there, lovely, and look at that. Beautiful. For what I want to do later on, all I'm going to do, because we're only doing a very basic bit of inner leg massage, is I'm just going to fold that piece of towel up there to expose that. But for now, we'll just keep all that touch covered. Are you happy with that for your leg draping? Yep.
Long
It is
strokes
nice.
to thigh. And then repeat to lower.
Yep, all our long strokes are general effleurage. We'll just get some oil on there first. Oh, you are dry, aren't you? Mm-hmm. Alright, so we've got our nice effleurage strokes. Get the palm effleurage going. So you can do some longitudinal work here. I find during the pregnancy, because your compression and separating strokes are all really good for the lymph as well, they're great during pregnancy. So we can get a lot of that stuff happening. We're doing those nice separating strokes. They just feel nice on the thigh, don't they? They're just not very even. I'm not going to go too much with my nice deep side leg techniques here. Knuckles. Knuckles can go right up. Sorry?
Knuckles and elbows.
Yep. So knuckles there. Still not too deep. Okay. Same thing, I can get the compression and separation going. How's that feel? Nice? If we were going to do some forearms, it's just going to be some really nice forearms, so I'm just using the meat of my forearm, as opposed to using the ulnar, or being really mean and getting in with the tip of the elbow. Alright, so we can just work all through that leg. They did have a lot of fluid, that's where this, the C effleurage is going to come into it. So we want to do a lot of that kind of work. And if they are quite tender down through the lower leg, just some of your circular thumb frictions, just nice and light. Don't get too mean in there. We're working on someone that did have a bit more injury. You might be a little more vigorous. Sleepy yet?
No.
No. No, we'll have to keep going then. Then repeat to the lower leg. Okay, I have done this just a little bit wrong there. I want to slide that towel down just a touch. There we go. I want that foot mostly on that pillow. You don't want them having the foot hanging too much, because you can actually cut a little bit of blood circulation off in the foot if they do have a lot of relaxant work. Okay? Here I'm not going to forearm at all. Okay, I might just do just a little bit of knuckles there. Be tight in the peroneals, in the shins. we have to watch out if they've got varicose veins coming out. What are we going to do over them?
Avoid them.
Very light work, and that's it. Okay, so if I was going to work up and there was any big varicose veins, say we had some varicose veins through here, I might even do just a little bit of deep work back right off and then come back in over the top of them. Or you might work up and do the split, okay? Which is normally what I do if there's any scrapes or cuts or pimples or anything like that I don't want to touch. I do the split work and stay away from it, okay? So down here feels really nice just using that palm. A lot of nice compressing and separating work, okay? Yep.
Massage the foot.
Yep, massage the foot. You guys know how to massage the foot, don't you? Yeah. It'd be very vigorous around the heel, yes? Not a heel work? No, no heel work. What if she was 40 weeks?
Yeah.
We're okay. Doesn't matter.
You want them done.
Should we go straight to the ankle?
Okay, so we can go working through the top of the feet here. You can do all your separation work. There's no fluid down here. You can do a bit of your traction work. Okay. Just remember a lot of that separating work normally feels really, really good if they do have the fluid. Okay? Just don't traction and make joint space for the fluid to get into. Okay, bottom leg.
Drainage.
Oh, lymphatic drainage work. Which one have I got? Catch scratch?
Oh yeah,
Yes.
that's scratch, yeah.
Yeah, okay, cool. So as you can see, I do this one at the end for a regular massage, but if they did have that, not lymphedema, but if they did have a lot of swelling, a lot of edema, you do this right at the start, okay? So you can start with a little bit of your C-cup work up in the upper leg because the catch scratch just isn't going to make it, it's not going to do anything up here, it's just not enough work, okay? But then I can come through and just start doing some of that dragging work. Always reminds me that go slowly with the cat in the little box. Okay.
Or if you like my cat, I just
Alright, lovely. Lower leg?
Yeah, understood.
Yep.
No strokes in the massage.
Yep, so all I'm going to do is just a little bit of the lower leg there. I'm not going to get right up, too high up in the thigh. It's all pretty simple. Now, if there's any risk, if they've got any big, as you can see, a couple of blood vessels here, okay, it's just little spider veins there. If they had any big DVTs through here, or they've had a lot of heart and things like that, you always think risk of DVT, of a blood clot during pregnancy, because they are a lot more common then. So if you actually do a lot of deep work, you don't have any calf cramps or any of the sort of just sitting there, okay? If they do have any blood clots through here and we start working really deep, we can break off a bit of blood clot. It becomes embolus. Embolus goes up to the heart. Maybe gives you a heart attack. If you go with the normal way, it goes up in your brain, it gives you a stroke. So we generally don't want to give people strokes. Right, so I would just be sticking clear of any deep work through here at all, even through the upper thigh. Okay, so stick more around the back of the calf a little bit and hit more of the hamstring there. Okay, so that I'm not getting in there. Again, the nice compressive strokes are all good. Alright, so if you just stick to longitudinal work and nice compressions and separations, it always feels really nice. Okay? Beautiful. Massage the foot and massage the foot. The big part here is you get into that arch. This is where I just have a little bit of a bludge and do a nice little bit of arch massage. Okay? And get in and see how she's feeling. Anything going on between the toes there? Base of the foot? No? All feel alright? Yeah. The feet get a bit sore when you're pregnant? Yeah, you say so. Okay? Don't forget knuckles, palms, anything working towards the heel, but basically where she's just a little red here, I just stay out of there and this lower part of the ankle for sure. Okay? Simple. It's not a very hard massage. Okay?